Hello everyone, welcome back, or welcome for the first time to our Meals for the Stomach Cancer Patient. This is our summer edition. Welcome back for those of you who attended our spring edition. I'm back with Miss Mary Eve Brown, our nutritionist. Today we're going to be talking about some delicious recipes, fresh, refreshing, and always set for the summer. So we're going to jump right into everything. Miss Mary Eve's going to keep an eye on our comments and see if we have any questions. We're going to start, just in terms of time management, we're going to start with our sauce for our main entree, our salmon, which is going to be going with some delicious lemon orzo and roasted zucchini. We're going to start that first because it's going to need some time to reduce. So in the meanwhile, how's your summer starting off?
Good.
Good.
I'm excited.
It's beautiful outside, isn't it?
Today in Baltimore, it's really, really beautiful.
Really beautiful.
What I love about summer so much is, here in Maryland, the farmers markets start opening up, and so we can get local produce, which is always best to do if you can get it local.
Yes, that's definitely a focus of our program as well. It's funny, every time I shop for this this program, I seem to come up short finding ingredients, but it's sort of a good thing because that means that people are buying that, which means that it's in season, it's popular, so sort of a good problem to have. So we're going to start off here for our sauce. It's a traditional veloute sauce. We're just starting off with some butter, and we're going to add some flour to that to make our roux. The roux is our thickening agent, and that's a very classic way to thicken any sauce. The veloute sauce itself is one of the 5 classic French mother sauces. And so basically what you're doing there is you're starting with just a couple of ingredients, and from there you'll make a derivative sauce, just adding a couple of extra ingredients. You'd be surprised at the multitude of sauces that come from just those 5 sauces to start with, those mother sauces. So again, we're going to melt this down. I'm going to turn that up a little bit. Once we make the roux, we're going to add in our veggie stock. Traditionally, a veloute is going to be made with fish stock, and actually that would be ideal for what we're making today since we're working with the salmon. But veggie stock is a little more neutral, and it's just, for me personally, easier to kind of keep in mind. So we're going to keep melting this butter down. We're also going to multitask a little bit and get our soup set up and starting. Now, I'm making a soup in the summer. You might think it's a little strange, but this soup is good hot or chilled. So if you find yourself on a chilly summer night, which happens sometimes, especially up here, then so much the better. And if not, just let it chill down and eat it after that. It's going to be our carrot ginger soup. And that works
Really well wherever you are in your journey.
Any kind of patient.
So if you are actively in treatment or you're post-gastrectomy or even years out, using a soup can sometimes be really nice because if your pocket is small or you have no pocket.
Right.
And I like that ginger is also a digestive aid.
Yes, definitely. Although I thought to ask you this today, working with the ginger. I love ginger. In some ways I can't get enough, of course. Eventually you do. Is there a limit to the amount of ginger you can eat? Because I know it's a very pungent ingredient.
No, there's no limit.
Okay, that's good to know.
Yeah.
So we're going to get this a little hotter.
As well.
Yeah, as do I. Lately I've been experimenting with making ginger ale at home, actually. I have a soda stream machine, and I've been reducing some ginger into an extract. Sometimes it's not quite the same, but that's the fun of experimenting.
Yeah, so you can take your ginger, peel it, chop it. You're going to boil in water for about 15 to 20 minutes, depending on how strong you like it. Then strain it, and then you can sip that warm. It's a digestive aid, or you can make your own ginger ale with it. So ginger ale typically doesn't have much ginger in it.
Right.
But
I knew.
But making your own is really nice. And you could put honey in it. You could put lemon in it. You can season it up however you want to.
Right.
Gastric patients can't eat and drink at the same time, so you would be doing that, separate from a meal.
Definitely.
Yeah.
Yes. And as you mentioned in our last show, drinking and eating always kept separate. So that's something to think about as well. And in the soup's case, you're sort of almost beating that problem because you're able to drink and eat almost at the same time.
You're getting nourishment in what you're drinking. Yeah.
Exactly.
Yeah.
All right, so the butter's starting to get hot. Once it gets hot, we don't want it to burn. There is in butter a little bit of water content, so you have a little wiggle room. But once you see the bubbles stop, that you've pretty much already gone past the point that's safe, and you're probably just going to be burning it at that point.
If you're sensitive, could you use ghee?
Definitely, yes.
Okay.
Ghee or clarified butter we could also use. That's going to take the milk solids out of it, thank you. And that's going to be also a higher smoke point, which is beneficial.
Yep.
So we're going to have this, I'm going to get that nice and hot, so we're starting to see some bubbles. So we're going to add to our roux that's equal parts fat and flour. You don't have to use butter, you could use any kind of oil, you could use bacon fat. I know some people like to make their roux with bacon fat. It's going to look a little pasty, and I know a lot of people tell me that roux smells while it's cooking, kind of like cream of wheat. So if you start to smell, then that aroma, then you are in good shape. For our veloute, we're making a blonde roux. There's a few stages of the roux. As you continue to cook it, you're going to see, as you have now, it's pretty much a paste. And as you continue to cook it, it should stay pretty pasty. You might have a little bit of liquid to it, but essentially, it's going to stay as it is and keep cooking. But you'll see it changes color. It's going to get a little browner, sort of notes of peanut butter almost, until then it's super brown. And don't worry, it's not burnt, but for our purposes, it's too dark for this recipe because we want a lighter, creamier looking sauce. So we're going to make what's called a blonde roux. So we're actually almost there. You can see it's, really blonde, almost like a blondie brownie. I don't know really what else to call that, but so just a few more minutes on that. I'm going to actually turn this up. Once the flour is incorporated, you don't have to worry about burning the butter or anything like that. So once you've got this going, one warning as well, this stuff is hot. Do not get it on your skin, or try your best not to. It will definitely leave a mark.
I have a question.
Sure.
I'm experiencing gastric spasms. Any suggestions on how to manage?
So I will definitely defer to you.
Okay. So you're going to want to avoid things that are gassy in nature, like the cruciferous guys, broccoli.
Okay.
We were just talking about Brussels sprouts,
Anything
cabbage.
From, I believe, the brassica family, so cabbage, stuff like
Yeah,
that as
they're
well.
all gassy, so you don't want to put gassy things in there. Carbonation, I would stay away from things that are carbonated.
Okay.
I wouldn't, this is terrible, but when you're eating, try not to talk much, because when you are eating and talking, you swallow air.
Right.
So that could be, discomfort.
Yeah, that's definitely not good.
Eating small, frequent, chewing really well. You may need to stay away from things that have a lot of spice to them, things that are in the dairy group. Those are all things that can cause more gastric distress. The other is don't eat and lay down. Sometimes people after their surgery don't feel well after they eat and they lay down. Don't lay down. You can recline, but don't lay totally.
Gotcha.
Totally down.
That'll
aid in digestion.
Exactly.
Sometimes but if you can walk around afterwards, it's a good idea. But if not, don't lay flat. That's kind of the
so walking
aids digestion.
I was going to say, in general, I've heard that that's a good thing to do after eating anyway to help with digestion. So there you go.
And when you don't have a stomach anymore, things are going in different parts of the gut that aren't used to each other. And it takes a while after surgery for your anatomy kind of to settle and get used to its new anatomy. I have some people who can go back to a total oral diet, and then I have other people who have to continue to follow a gastrectomy diet. They just didn't recover the same way.
Yeah, it's different for everyone, and that's definitely something that I love to talk about when I'm cooking. Is if something in the ingredients we're talking about is something that doesn't agree with you, just leave it right out. A lot of times you'll find even new flavors that we hadn't thought of because you're adding something different to the same sort of base of ingredients. For example, we have zucchini today. You might want to choose a different summer squash, yellow squash, or even just a different vegetable altogether. If that suits your needs, and that's totally fine. For me, food is about enjoying more than anything else. So this roux is actually taking a little longer than I expected, but that's fine. Again, just monitor the color. It's still very blonde. It's almost completely white still. But you want to make sure that you're cooking the flour out of it, the flour taste and sort of content out of it. So again, just as long as the color is fine, then you're still good to go. But I will note that once it starts to change color, it will start to continue changing color rapidly. So keep an eye on it.
It'll go from that to dark?
Yes, yeah. in a matter of minutes. So we'll just want to make sure you're seeing some bubbles. That's a good sign. We have the olive oil here, though. We're going to move right along to our soup. So we're going to add our onions for our carrot ginger soup. Onions is just pretty much what you start almost every recipe with. And we're going to open up those flavors. Just give it, one flew out there. and you're just going to what they call sweat the onions. So sweating the onions, basically what you're doing is just giving it a little time for the water to cook out and evaporate. You'll notice that the onions are going to start to become translucent as opposed to the white they start off as. Past that, any more cooking than that, you're starting to get into caramelization, which is delicious, but not exactly what we're after in this recipe. So we're going mostly for the onion's flavor in and of itself.
And cooked onions are easier to digest than raw onions. So
exactly.
That's important for somebody going through treatment or
see,
getting
just
brown.
What I was talking about, you'll see there's a slight color change now, and we're actually going to pretty much end the process now before it gets any hotter. And sometimes even if you want to take the pan off just for a second, because like I said, this roux will continue to cook. We have it at a blonde stage now. In just a minute longer, it would probably turn into almost a peanut butter color. And at that point, you're looking at more of a brown roux, which is what you would use in something like a gumbo, that sort of thing. It imparts more of a smoky, earthy flavor. Again, but since we're using this mostly for its thickening and less so for its flavor, we're going to keep it at a blonde roux.
All right, so I have a question about the benefits of fruits and vegetables. What are the best
What aren't there?
what are the best cancer fruits and vegetables to incorporate in my diet? So each color of a vegetable gives you a different cancer fighter. So they're called phytonutrients. So things that are orange, like our carrots, are going to have a different phytochemical than our zucchini or our onions.
Exactly. All those different colors provide different nutrients.
Each color gives a different cancer fighter. The dilemma can be with after surgery or even while maybe you're in treatment, fruits and vegetables can sometimes be difficult to digest. But if you seed things, you skin things, which we were talking about earlier with Zach, is that the zucchini, you can definitely peel it and seed it and still use it in this recipe if you're not able to digest that. And then well-cooked things are going to be easier to digest than raw. But there's no, somebody says, what's the one thing I should eat every day? We're like, no, it's a variety, right? Moderate everything.
And variety.
Variety is really, really the answer.
And I would argue that that's for anyone, not just for the stomach cancer patient or for those dealing with gastrectomy issues. Really just anytime you want to talk about nutrition, what is the best way to get good stuff into my body? It is the very variety of stuff itself is what gives you the benefits, because things work together and potentiate each other and make sort of work better within your body.
And when you eat seasonally, which is what we're trying to do, you're going to get more variety in.
Exactly.
If you have a farmer's market near you, I mean here, in Maryland, they're starting to open up. So get to the farmer's market, support your local farmers, or join a CSA. So a CSA is a cooperative that you are buying part of this farm, and you get the benefit of the produce. And what I really love about it is it gets me doing things I normally wouldn't do. So you get a box, and you open your box, and it's going to be different things in your box, and you may not be something that you're used to seeing or even have tried before. It gets you trying new things.
Exactly. And there's someone there to encourage you a little bit. I know I myself, I love to experiment, but I've seen a lot of people, they'll come up to the stand, they sort of look with hesitation at what this fruit might be, or they don't even know where to start with it, how to open it, how to cook it. So the person at the stall will reassure them, and I got you, this is how you cut it, this is how you eat it, it goes great in a smoothie, that sort of thing.
Yeah, I love a CSA. Or in a farmer's market too.
Mm-hmm. So we're gonna, we have the roux here. What I was doing while I was talking to Mary Eve is we really just stirred the roux into our veggie stock, or traditionally it would be a fish stock, but as you can see, it's a nice smooth consistency now. You really wanna get your elbow grease in there because you want no lumps. So the no lump idea is really just vigorously stirring it. You are tempering to a certain extent. So the best is to do cold into hot, but slowly, or the other way around. And I notice my onions, as I was talking about, they're starting to caramelize, which is fine. But again, if I know not everyone can do caramelize, is that correct?
It's the sugar content.
Exactly.
So when you have your stomach removed, things that have a lot of sugar in them can cause a lot of gastric distress. And it's called dumping syndrome, so things can fall into your small bowel or dump into your small bowel. And the small bowel is not really the place where that should be, so it can drop your blood sugar, it can give you cramping, it can give you diarrhea, make you feel fatigued.
So I'll just show the camera a little. We're starting to see a little bit of brown, which in general, brown equals flavor when you're talking about little burnt edges and stuff like that. But again, like we were just talking about, to have the most advantageous soup for yourself, you just want to sweat these onions a little bit.
I have a question. Do any of the ingredients pose possible interactions with my medications?
I suppose that would depend on a lot of
It would
variables.
depend on what medications you're taking. I don't.
Yeah, I wish I could answer that question.
I don't think so. So the only kind of the one that we worry about the most is if you're on Coumadin, which is a blood thinner.
Okay.
You have to be consistent in your leafy greens. The message way back when was like, you can't eat anything that's green. Well, that's not right. It's just consistency. So if I have, a cup of greens, every day, then I continue that. I don't go one day without and one day with two. It's consistency in amount is the key with it. But none of these ingredients that I can think of would pose a risk for any particular medication.
Okay, that's good to know.
Yeah.
And I suppose, again, at the end of the day, as we've talked about before, it's really about your personal experience. So if something doesn't sit right with you, then maybe see individually on an ingredient level. Of course, medication's a little different. You do have to consult with your doctor, but in terms of ingredients, taking each individual ingredient and either taking it out or adding it back into the dish, seeing how that makes you feel is also a big part of it. Maybe, for all we know, there is something that does interact with the medication that is preventing the nutrition from getting in, that sort of thing.
And you can always discuss with your pharmacist and your physician as well.
Mm-hmm.
Okay, so I have a question. Why do skins of fruits and vegetables not break down easily? Do the skins hold any nutritional value? If so, does boiling skins help in the digestive process to retain their nutrients? That's a really good question.
Great question.
So, yeah, skins are harder to digest. So in the beginning stages of the gastrectomy, or even during chemotherapy, sometimes when you're having a lot of issues with digestion, skins are going to make that harder to digest. Even cooking them well, I still recommend just peeling them just so it's easier digestion. So this is a really good question about, do I remove some of the nutrient value when I skin something? And you do to a small degree. The vitamins and minerals tend to live closer to the skin, so if you can eat the skin, we usually recommend eating the skin.
It seems like a catch-22 to some extent.
But if you're not digesting it and you feel terrible after eating it, that's not a good thing either.
Right.
So it's kind of figuring out your digestion, and if you do better with not doing skins and seeds, that's the way you want to go. If it doesn't bother you and it's cooked well, then you can do it.
Makes sense to me.
The other thing, and I don't know if you do this, Zach, too, is I'll take my scraps and you can keep them in a freezer bag, and then you can make your own stock from them.
Oh, sure.
And that's a really not time saver, but a cost-saving thing.
Yeah, a lot of times making stock from scratch is definitely a cost saver. The stock at the store costs about $2 for a quart, and you can, just yesterday actually for our purposes, I made veggie stock. I made about 10 quarts worth for maybe a couple of dollars worth of vegetables.
So if you feel bad about skinning things and seeding things, you can use it in another way. I would make a.
I was going to ask, is there anything you can do with the skins?
Yeah, I would make a stock.
There you go. All right, so we've got our veloute about to come to a boil, and then we will very quickly bring it back down to a simmer. We've got a few bubbles going. We're going to let our carrots cook just for a few minutes, and then we'll add in some stock. The recipe that we were talking about mentions 3 to 4 cups of the stock or broth or what have you. And I would recommend going on the lighter side. I like a nice thick carrot soup. If you go a little too thin, you can start to feel the grains of pulverized carrot between sort of bites, and it doesn't make for as delicious of a dish. So.
And you can use other colored carrots. You could use purple.
Oh,
yes,
yes,
you could use white.
absolutely. And those actually are starting to be in season in the summer too, I believe, the different colored carrots. Orange carrots actually have an interesting historical link to, I believe, the Dutch, who wanted to celebrate their legacy by, because I guess their national color was orange, something like that. So at the end of the day, they prioritized orange carrots, and that's truly why orange carrots are what we know as one-to-one as carrots today, when in fact there are multiple varieties, multiple colors of carrots. So we've got that out there in the world to explore, and taste exactly the same. So there's really, no harm. And like we were talking about phytochemicals, there's going to be different phytochemicals involved even in those different carrots. So even within the same ingredient, you're going to have different phytochemicals.
Depending on the variety of color.
Exactly.
So what are the benefits of ginger is one question. So ginger is a natural anti-nauseant. So if you're having nausea with treatment, or nausea can even be a part of the symptoms after gastrectomy. So doing ginger can be a natural way to help with nausea.
Yeah, I definitely know when I feel nauseous, ginger ale is my go-to, so that makes a lot of sense. So I just poured in our veggie stock. We're going to keep cooking this down, but I'm going to make sure to scrape on the bottom of the pan. And the reason I'm giving it a good scrape is when the liquid hits the pan, it's going to loosen up all of the sort of yummy stuff at the bottom that's cooked in from what we've just cooked. And so instead of losing that to the pan, you bring it back in to the flavor matrix. So we're just going to cook that. We're going to bring that up to a boil and then reduce to a simmer. This actually I'm going to turn down a little. You never want anything to boil in the kitchen if you can help it. You want to bring it to a boil, but then you're going to reduce it to a simmer. Anytime you're cooking really anything. Boiling is sort of antithetical in the kitchen. It's just a mark that you hit and then come back from.
I wish people could smell this soup because it's fantastic smelling.
Yeah, isn't it? It's really good, and as I was saying, you can eat it chilled as well. One thing I would mention is everything in general, you're going to taste more flavors and aromas when it's hotter, so you might miss out on a few notes of flavor, but it's definitely still going to be delicious. It's definitely going to be very filling.
It's interesting you said that. So when things are room temperature cold, they don't have as much odor. Mm-hmm. So if you're having nausea, doing things at a room temperature or cold are going to sit better, because if your tummy is upset, the smell of food can make that worse.
Exactly.
So doing things,
strong aromas, that sort of thing. I remember last time I talked about how me personally, I love the aroma and taste and everything about onions. But as we talked about a little bit, and actually I talked with some friends and family, some people actually find onions to be quite overpowering. So I'll apologize for just my preference there, not necessarily a hard and fast rule. And again, that's sort of an example of how things really are sort of in the eye of the beholder. Next, we're going to toss some zucchini, which is cut lengthwise, in just a little olive oil, salt, and pepper, and we're going to throw it right back here in the oven to roast off. Again, everything here is a couple of steps, and then you're right to it, which makes life a lot easier. So again, just a little olive oil.
So we also talked about you can roast it, or you can saute it, mm-hmm. or you can grill it.
Yes, lots of different techniques.
Different ways to prepare it.
And they're all going to give you a little bit of different texture, a little bit of different sort of taste profile. The recipe we were talking about actually calls for grilling it, but we don't have a grill indoors, so we will make do with roasting. But yeah, you could definitely also saute.
So if there's a vegetable that you don't like, cook it in a different way, and you might like it.
That's an
I think a lot
point.
of people have bad memories of being a child,
yes.
and it's overly cooked and soggy and unappealing.
100%.
If you change the cooking method, it might be something that you find like, oh, I really like zucchini, or I really like eggplant. Thinking of it in a different way.
Yes, my go-to example for that is Brussels sprouts. When I was younger, I ate them boiled. And
Overly boiled?
Precisely, and I did not enjoy them. Now I prefer them roasted, or even fried, actually. Fried Brussels sprouts are one of my favorites.
Yeah.
So we're going to let that go. When you're monitoring this for time's sake, you're talking about just a number of minutes, not more than 10, 20 minutes. They cook very quickly. It depends on how thick you slice them, but at the end of the day, it's not going to take very long.
It can also be, summer squash instead of zucchini.
Definitely, yeah. I think those actually are going to have about the same profile in terms of nutrition.
Yeah, and then eggplant too. Like I'm thinking.
Sure. Eggplant too.
Because that would go with that profile as.
Oh yeah, definitely.
as well, yeah.
So I am definitely going to turn this down and give it a little stir. You may notice there's a little bit of a skin forms as you cook. That is a good thing. That's telling you that it's thickening up. But again, just keep stirring it. You don't want any lumps. You want a nice, smooth consistency. And again, this veloute was very simple to make. We made a roux, so we made the flour and butter, and then we added some stock, and there's our sauce. There are a lot of derivative sauces that can be made from this. If you were to add just a little bit of heavy cream, you'd have what's known as a supreme sauce. All that you had to do was add some cream, and it became a brand new sauce. So there's a lot of these sort of variations that you can find with just a little bit of research online too. A lot of cookbooks have these in there as well, of course. So this is cooking down. We've got our veloute going. Our salmon is not going to take any time at all. The fish cooks very quickly, and it's very delicate. So all we're going to be doing with it is searing it very quickly. After I remove the soup, we're going to sear it on a pan very quickly to give it a nice outside, and then we're going to put it in the oven for a few more minutes and let it cook. But it shouldn't take very long at all. So we have our zucchini cooking. We have just about everything going. The one thing that we haven't started is our banana ice cream. Our vegan banana ice cream. I'm very excited about that. This is actually a recipe that I've liked to make in the past. Oh, here they are. So this is a one ingredient recipe. We have frozen bananas, which yesterday I cut up into small coins and popped them in the freezer. You can pop them in as long as overnight, even just a couple of hours to help stiffen up and freeze the product. But yeah, overnight's definitely recommended. We're going to take this, we're going to pop it, hopefully not too messily, right in the food processor.
The bananas are super easy to digest.
And you can tell already they have this perfect texture.
And sometimes we can't do, after gastrectomy, we can't do frozen desserts because the dairy and the sugar will both cause dumping. So I love this idea that I'm having a frozen dessert, but I can digest it pretty easily.
And this concludes everything that you put in your banana ice cream. It is bananas in the food processor. I will, with one exception, add a little bit of vanilla extract. And it's not to, strangely enough, or counter to what you might think, it's not to make it taste more like vanilla. It's actually to bring out the banana flavor. Vanilla extract in the baking world works much like salt or pepper in the culinary world. It just enhances and brings out all the other flavors. So this is going to make the banana flavor a little more sort of palatable, a little nicer, a little more luscious on the tongue. So we're going to go ahead and start pulverizing. We're not, though, going to pulverize this to completion because this takes a while. I just wanted to show you briefly, though, exactly, and we can barely hear me too. It starts off, you'll have a sort of a mush. You'll continue to go, and you'll have almost a paste. You will just get discouraged. I got discouraged. Trust me, just keep going. Just keep going. It may get stuck. It might sit there for a little bit, and only the motor is whirring. I promise you, just keep going, and you will get a delicious banana ice cream, which I have already made for us to scoop out. So we'll go ahead and dish that out and have that served.
Okay, a question about benefits of fruits and bananas. So bananas are high in potassium. They are high in pectin, which means that it can firm up if you're having any problems with diarrhea. It's a wonderful thing to do, is bananas. Other fruits, they have vitamin C in them. And this is what I always say is that fruit nutrition is in vegetable, but vegetable nutrition is not in fruit. So you need less servings of fruit a day and more servings of vegetable a day. You only need 2 servings of a fruit a day.
Now that makes sense to me because there's more sugar content. So it's going to be antithetical to what you're after.
I mean, there are phytonutrients in fruits as well. Like lycopene is in watermelon, and lycopene has really good research with it with other types of cancer. But you only need 2 servings of fruit a day, but you need 3 to 4 servings of vegetable a day. So if I find people are doing much more fruit, I try to kind of pull them a little bit more. What about your veg? Let's get a little bit more vegetable in there. Oh, that's beautiful, Zach.
Okay, so a little on the soft side. I had it sitting here in my cooler while we were waiting to serve it, so it's a little on the soft side. It will become a hard pack, though, just like any traditional ice cream if you leave it in the freezer. And so yeah, again, pulverizing it, it's going right into any container, right in the freezer, and you're done. That's our vegan ice cream. So again, a little melty, my apologies, but we're going to go ahead and move right on. So our soup, for all intents and purposes, you would put this on for 30 minutes to an hour to simmer. But today, because of a little TV magic, we're going to just have our finished product here. And as you can see, it's actually cooked down a little while it's been sitting on the heat. But you have this amazing color, you have this nice thick consistency. So yeah, it is a little thicker than I personally like, just because, as I mentioned, the water cooked out of it as we were discussing the recipes, but that's fine. It's still actually, it might actually work better cold in this way, sort of a thick filling sort of thing.
I also sometimes add coconut milk to that.
Yes, actually we're going to garnish with coconut milk.
Yeah, so if you can't do dairy, coconut milk can provide that creamy kind of milky texture in a non-dairy way.
Yes, so we have a little coconut milk, and we're going to just give it a little zhuzh. A little bit on top, a little sprig of, I have parsley here, again, because of just a little trouble finding products. I was going to go for cilantro. Cilantro would actually go really well with the ginger and the carrots in this recipe. I'm really just using it for a garnish, but definitely if you even are going for the garnish, in my opinion, you should be able to eat everything on your dish. So you could definitely eat this parsley leaf, but that extra little flavor from cilantro I would definitely recommend. So here we have our carrot ginger soup.
If it doesn't taste like soap, because
that is a great point. If it does not taste like soap, because some people have a genetic, they have a gene that expresses by making cilantro taste like soap, which is fascinating to me. I'm glad I don't have that.
I know, me too. And you know, having an herb garden is a great thing. They're so easy to grow. They're weeds. They're so easy to grow. You just need a sunny window or a patio or a deck, something that you can just put out pots of herbs, and then you just go out and snip them.
And it's sort of almost a meditation, like a pleasure in just being outside, getting your hands in the dirt. I always find that to be very, very relaxing as well.
And they are phytonutrient bombs. Because they're so concentrated, they're very, very strong in phytonutrients and fight cancer. So win-win.
Win-win.
Flavor and fighting cancer.
So our zucchini is just about ready. I'm going to turn this down a little.
What's an alternative to coconut milk? For this,
Yeah, I was going to say some cold milks don't really work as hot milks that aren't actual milk, like oat milk, almond milk. I haven't personally experimented with a lot of those, so I don't want to say one way or the other. It's already starting to thicken up really nicely. If you want to take a look here, we're already starting to get a little nice wave here. So this veloute is almost ready. Our zucchini is almost ready. Of course, we have our soup and our ice cream ready. We're about to take our salmon and give it a nice sear, and we're almost about to have a delicious entree.
Yeah, sometimes people are intimidated to cook salmon, but it's really simple.
Yes. It's also got a lot of great nutrients in it.
So it has the omega-3s in it, which are cancer-fighting inflammation. It's a great source of protein. It's pretty easy to digest. So when you're buying salmon, you want to know where it's coming from.
Definitely.
So Zach and I were kind of talking about, should it be farm-raised or should it be wild? Each of them have pros and cons to them. I tend to encourage people to buy wild instead of farmed. One of the pros to farming is it tends to be less expensive, but the nutrient content is a little bit different.
Right.
They tend to be, the fish are getting fed fish food, kind of, and that then changes the nutrient content of the fish. It's going to be maybe higher in saturated fat, which is not a good thing. It can have less omega-3s in them. So the wild has a more varied diet. So they're eating whatever they're coming in contact with. So they're eating a wide variety of different things.
Right.
Just like we were talking about people.
Exactly.
Eat a wide variety of things.
Healthier and thus more nutritious, more delicious.
The other thing is because, I think this is going to change, but they can be farmed in containers, they can be farmed in rivers, they can be farmed in the sea. If they are close to each other, they can have a problem with infections. So sometimes part of what they're getting is also antibiotics to keep the infection away. And to me, I'm kind of like, I don't really want to expose myself to that, so I'd rather have something that's not exposed to antibiotics.
That makes sense.
So it's wild caught.
Yeah, that definitely makes sense. All right, so this should be hot enough. Oh yeah, love these induction stoves. So we're going to take our salmon. All I've done is put a little bit of salt and pepper. Hear that nice sear. You want a nice hot pan so that you can get that Maillard reaction, that caramelization in the presence of a protein. Let's see if I can't turn it up a little. Perfect. So we, again, aren't going to be cooking that for that long. A few minutes to get a nice sear. In terms of when it's ready, just kind of let the fish or protein tell you. It's going to come off on its own. If you try to pull it off early, it may leave some bits on the pan. So give it its time. You'll have a beautiful brown, crispy outside, and then we'll throw it right in the oven. I'm just taking a peek over there. I think they're
good.
Yeah, they look good, right? So those are almost ready. Our sauce is reducing down quite nicely. I've already pre-cooked some orzo. We have it here for you. I'm going to mix that together for our side with the zucchini. The orzo looks like rice, but it is pasta,
right,
which I always find really amusing. But it cooks just like pasta. So you're going to boil water. You're going to throw it on in with some salt. Cook it to your al dente preference, or maybe a little softer, and you'll be good to go. 9 minutes, 10 minutes or so on the boil. One thing I would mention that I did personally is I actually cooked this orzo in veggie stock. So as opposed to cooking it in simple water, anytime you're going to use water, you might think to yourself, how can I infuse more flavor into this dish? So fish stock or veggie stock, cooking with an orzo that's going with a fish, is going to really help bring out some new layers of flavor.
I also suggest to people who are having a hard time getting their protein in if they're in treatment, is to cook in bone broth. So you can cook rice, orzo, pasta in bone broth. That way it sucks up that extra protein and flavor. But there was a question about, are there alternatives to the orzo?
Yes, I believe there. So I suppose it, again, depends on your digestion level. If you're looking for a small, sort of rice-like grain, you might try couscous. You might try, honestly, a rice would go famously with salmon, any kind of rice, really.
Yeah.
The orzo is nice because it has a little softer of a texture than rice, so that sort of benefits the softness of the fish.
So if you have a gluten problem or a digestive problem, I totally would go with rice.
Exactly.
I think it would work well, and like you said, any kind, like basmati or jasmine, or
Sure.
you could do a different type of rice.
So I'm testing it, and it's still sticking a little, so we'll give that a minute. I'm going to pull the zucchini out.
I have a question. What's the benefit of salmon versus chicken? So salmon, again, has, they're both good protein sources. They both tend to be pretty well digested for people who have gastric cancer. That's awesome looking.
Quick. We have some nice browning going on, a little bit of crispy edges. That's what you're looking for. I'm sorry.
No. Chicken does not have, the omega-3 in it that the salmon does. And for a prevention diet or a survivorship diet, you should try to have some type of fatty fish twice a week if you can.
And this is one of the most popular, that's for sure. Also one of the most readily available. And like we were talking about before, even if you can't find the wild caught or specific Atlantic salmon, even the salmon in the frozen aisle will be just fine. It definitely has a lot of nutrients in it.
Or canned. I have canned salmon in my pantry. Actually, I buy it in a pack. I don't buy it in a can. It's wild caught, certified wild caught. It doesn't have the bones in it. I used to buy the ones with the bones in it, which was terrible. I had to, debone it. But I put it on top of a salad. I make a salmon loaf. I make a salmon patty. So
oh yes,
that looks
so
awesome.
Let's just take a little close up here. We've got a nice sear. Could even go a little longer in my opinion, but you start to see that really beautiful color come out. We're going to throw this right in the oven.
And Zach was saying, you don't have to cook it all the way through.
Yes, thank you.
But if you are immune compromised, you do have to cook it all the way through. So if your immune system is not such that eating something that's raw could put you at risk, you want to cook it all the way through.
Yes, but for those who can eat something a little undercooked, it's very much like steak. You can have it medium rare or medium, and it's just fine. It'll be much darker red on the inside than it is on the outside. It's sort of that traditional pink. Totally safe to eat. So we have the pan that we used for our salmon, and we're going to go ahead and add a little bit of minced onion. We're just going to get a little bit of flavors going. This we're going to mix in with the orzo. And the reason I'm using the same pan is really because you're picking up all the flavors left by the salmon that you couldn't pick up, for example, like making a sauce, that sort of thing.
All right, I have a question about what's the health benefit of coconut milk versus almond milk for gastric cancer patients?
Sorry. I don't know if my
no one heard me.
overpowered you a little bit.
No one heard me.
Sorry, go right ahead.
I think that the benefit would be is you're going to, so dairy can dump, so milk can cause dumping. Coconut milk, you know, unsweetened coconut milk and almond milk don't have the lactose in them, so they're easier digestion because it's the milk sugar that can cause the dumping. So
Okay, so the lactose
yeah,
itself.
I mean, if you're buying a nut milk, I would look to one that's fortified in protein. So almond milk doesn't have much protein in it, and eating protein is really important during your treatment and then post-op. So if you're not getting your protein, you're going to burn your own protein source, which is your muscle mass. And once you start losing your muscle mass, everything gets harder. I call it what gets you up and out. It's what gets you out of bed, you know, cleaned up, doing all the things you want to do. It's your muscle mass. And when you start to lose that, just everyday activities can be exhausting. So can I get the protein in a different way? I would do a nut milk that's protein fortified, and there's a couple of different ones that are on the market. They tend to be a cashew and almond, but they're dairy free, so they're easy to digest, but you're going to get the same amount of protein as if you drank, you know, a regular milk. I like coconut milk just because of the flavor of it and the smoothness of it, the texture of it.
Yes, the texture is really what I love about it.
Yeah.
So I've just tossed the orzo around, bring it back up to heat. I've tossed it around in the shallots, or in this case I have onions, and I spiced it with a little bit of lemon as well as herb de Provence. So that's a nice little medley of herbs that we have. The prominent features of it, it's going to be like most spice blends. You'll have thyme, you'll have parsley, those sorts of things. You'll have fennel, but the key flavor is lavender.
Yeah.
So there's lavender, which you might have thought, I can't eat lavender. I thought it was just a flower. You definitely can eat lavender, and it's delicious. You might have even had it as a syrup flavoring your coffee or tea. You can even just eat the flower. You can cook it into your food as we've done here. So we have mixed it into the orzo. So we have that lemon flavor. We have that sort of varied aromatic flavor of the herb de Provence, which really is what it is. It is an herb blend from the Provence region of France. So that's where it gets its name.
I always use it in my ratatouille.
Yes,
Yeah.
it traditionally goes in ratatouille,
Yeah.
precisely.
And ratatouille is wonderful for the summer because tomatoes, zucchini, eggplant, you know, they're all in season and they all go together really well.
So we've got a little feta we'll mix in, a little pesto. Now you don't want too many flavors to combine, but the lemon, the pesto, the different cheeses, the Parmesan and the feta, those are all going to work together really nicely.
There was a question about using lime instead of lemon. I don't think lime would go in this.
It's going to be a different flavor. However, lime might be suited a little towards the carrot, especially if you use cilantro.
Yep.
That could be an interesting combination, but as much as they are close siblings in terms of evolution, they have very different flavor profiles.
And I think zesting is really a great idea too. One of my favorite tools, not only the immersion blender, but is my zester.
Orzo mix. Oh, our sauces. Good to go. So our salmon, maybe a minute more. Just let it roast off. Our sauce is about ready. I'm going to give it one final stir so it doesn't keep that skin. Our orzo is about ready. I think we're about ready to plate.
I think that orzo would be wonderful cold.
Yes, that's another one. Like some pasta salads are great cold. Orzo is great to eat cold too.
There was a question about feta cheese. Is it hard to digest? So softer cheeses can have more lactose in them than harder cheeses. So if I didn't put the feta in there, what would cheese be that you would think would go into that?
Parmesan, I would say. Maybe a Gruyere cheese, which is sort of in terms of flavor, a cross between a Swiss and a Parmesan. Yeah, those would be my recommendations. All right, so we are nearing the end of our summer meals program here. I'm gonna just go ahead and put these up for display. Oop. Yeah, this definitely is more on the soft serve side.
Still Still delicious.
Oh, still delicious. Almost like a smoothie, I guess we could say.
Yeah.
So we have our, basically like a lemon pesto orzo with the feta cheese and the herbe de Provence. Now you can definitely chop these up as well once they come out of the oven or beforehand. I like the length of the split right there. It has a nice sort of look to it. But if you want to chop them up, I actually would recommend beforehand because it can get a little squishy after you cook them. But there we have the zucchini, and actually, oh yeah, perfect. So if you were to cut into this, you may see that it is a little underdone, but honestly, if we just take a quick look at it before I plate, it's got a wonderful color to it throughout. If I give it a quick touch, it feels mostly firm. So actually that tells me that it's probably pretty much cooked the whole way through. Whoop. Make sure I don't drop that or burn myself.
And again, we did a good job because everything has a good color to it. You know,
yes,
you eat with your eyes first.
I need to zhuzh this with the spatula. There is actually a product called a fish spatula out there, and that is why we use it, because we just lost the skin. Well, that's just all right. So we're going to put that there. So we have the skin, unfortunately, still on the pan, as you can see. Mary Eve and I were both talking about the fact that we...
Do you eat the skin?
Right, do you eat the skin? I love the skin. I was asking her if there's any sort of detriments or anyone who can't handle the skin.
It can be harder to digest if you know, you're in treatment or soon after.
So that's something to be aware of. Me personally, I could eat just the skin. I love salmon skin so much. All right, so we are going to just dress this plate with a little bit of the veloute sauce. And again, this is the mother sauce, so if you wanted to add a little lemon juice, a little bit of brandy even, anything like that, you would be creating your own sauce out of the mother sauce. So here we are, just give it a nice little pour there. And there you have it. We have our summer meals for the stomach cancer patient. So we have, of course, our salmon, banana ice cream, and we have our carrot ginger soup. Let me just give this a wipe so it's picture perfect. And just wanted to thank everyone for joining us. Of course, we also want to thank our sponsors. We want to thank the Debbie's Dream Foundation. Of course, we also want to thank Horseshoe Casino and Gordan Ramsay Steak for hosting us. We look forward to the next event. We will see you all back here at Gordan Ramsay Steak on August 30th. Until then, stay safe, have a great summer, and we'll see you then. Take care.